This is a community consumed with the task of trying to halt the rash of reported suicides here. I sat in on a community meeting today, no cameras were allowed, as the community tried to struggle with what resources it has, tried to understand versus what resources it needs to actually accomplish something. And it is a hard task. I heard, for example, at the hospital that if they were to get more councillors, more healthcare workers, there's another problem. There's so much overcrowding here, so little accommodation, there's nowhere for people to live. Almost every family here has been touched by suicide in one way or another. I spoke to a woman whose niece took her own life after suffering with health problems and then being bullied.
What I wanted to share is about Sheraton, because I feel that almost that she's forgotten. I don't want her death to be in vain. I want something meaningful to come out of her death, that other children don't have to go through what she went through.
Extra healthcare workers were still arriving today and saying what almost everybody here says. This is a familiar problem, that they have seen this before in other communities across the north. This kind of heartbreak is not surprising. Havard, Gould, CBC News, Attawapiskat, Ontario.